Western Oncolytics develops novel therapies for cancer. We take cutting-edge treatments that show promise in early lab testing and prove their efficacy in clinical trials. Our lead therapy, the Wo12, is an immuno-oncolytic, a virus engineered to replicate in cancer cells while delivering several therapeutic genes that train the immune system to fight cancer. By this approach, the Wo12 has the potential to treat a wide range of cancers, possibly any solid tumor with limited side effects, and in combination with other treatments, particularly other immunotherapies. The Wo12 is derived from the Western reserve strain of the vaccinia virus, and each of its added genes directs the immune system to treat cancer in a separate way, but all in concert with each other. This approach of delivering multiple immunotherapies in one construct sets it apart from all other treatments. The Wo12 may be delivered intravenously or intratumorally. As the therapy enters and travels throughout the body, it avoids immediate immune system detection via a modified surface. This allows the virus to travel to its target and begin acting before the patient's immune system clears the virus from the body, which would otherwise hinder the therapy. If the virus enters healthy tissue, a gene modification renders it unable to sufficiently replicate, leaving healthy areas undamaged. Once the Wo12 enters a cancer cell, it utilizes the unique cancer cell chemistry and begins replicating, eventually making so many copies of itself that it bursts the cancer cell open, thus killing the cancer while making more copies of the therapy. These new therapeutic viruses then infect other nearby cancer cells, starting a chain reaction that kills cancer. This activity also triggers an immune response to the tumor, where immune cells not only remove cancer cells in the infected area directly, but also interact with the remaining parts of the cells lysed by the therapy, leading the immune system to recognize the unique chemistry of cancer associated with disease and lead to a lasting adaptive immune response throughout the body. This initial immunotherapy is heightened by several potent genes added to the virus. The first is the TRIF gene, which activates cytotoxic T cell production. T cells are the part of the immune system most effective in removing cancer cells, and their increased presence leads to greater tumor shrinkage. The second is the HPGDG gene, which decreases the number of immune-blocking or suppressive cells in the tumor environment. This allows the rest of the immune system, and particularly the T cells, to better enter the tumor and remove the cancer. This combination of cancer lysis, immune adaptation, T cell stimulation, and removal of immune inhibition work in concert, creating a therapeutic synergy. The therapeutic viruses produced within the body do not have the modified surface like the initially injected viruses, so the therapy will eventually be recognized and cleared from the patient by the immune system. The side effects are expected to be similar to a few days of flu-like symptoms compared to current, harsh chemotherapy. The Wo12 can travel to multiple and even undetected tumors, and the immune system can learn to counter cancer throughout the body, providing a systemic treatment. Comparison studies of an early Wo12 prototype versus a replica of a clinically demonstrated vaccina with GM-CSF gene therapy showed that Western Oncolytics technology performed significantly better than the oncolytic GM-CSF in mice with breast cancer tumors. A further study of the final Wo12 therapy within mice with renal cancer tumors showed it to be even more effective than the prototype and lastingly removed tumors in animal subjects. Western Oncolytics' team is dedicated to delivering this therapy to the many patients in need. The result will be a whole new level of therapy with the promise of greater safety and efficacy in cancer treatment.